human immunodeficiency virus infection and its impact on the public health. The global problems of HIV infection are that the acute primary infection are not recognized by the patient, diagnosis requires blood testing, and antiretroviral treatment is expensive. The HIV infection has not been eradicated globally because of two main obstacles: the lack of funding and resources. HIV infection progresses in three stages. In the acute primary infection, the patient will present with flu-like symptoms lasting 3 weeks, and where they will not suspect that they contracted the HIV illness, they do not get tested or treated for the HIV. In the asymptomatic stage, the retrovirus will replicate for many years, while the symptomatic infection will present with rapid weight loss, lymphadenopathy, and opportunistic infections. The retrovirus is the causative agent that attacks the CD4 T helper 2 cells of the patient's immune system. HIV is transmitted from one person to another through high-risk social and sexual behavior such as a contaminated blood on a syringe needle and body fluids like semen. AIDS is defined as a prolonged, untreated HIV coupled with opportunistic infections and CD4 levels below 200. In 2008, 33 million people all around the world were living with HIV. Today, HIV is concentrated in the United States and impoverished countries such as Sub-Saharan Africa, Congo, and India. CDC reported 3 communities that suffered the highest risk for living with HIV: African Americans, homosexual men engaging in unprotected sex, and intravenous drug users. The other potential communities with a moderate risk for living with HIV are women who engage in regular heterosexual intercourse with an HIV-infected man, a fetus from an HIV-infected pregnant woman, and unfrequently a patient receiving a blood transfusion or an organ transplant containing HIV. An imprecise headcount of confirmed HIV-infected cases is one of the future risks for the community. If the HIV screening system is inefficient, then there will not be enough medical supplies to control the illness from spreading to other communities. The lack of resources and high cost for global access to antiretroviral therapies for HIV-infected patients is another future risk for the community. While ART provision is a global priority, there is not a single healthcare approach that all countries agree to follow to decrease the high prevalence and incident rates. Each country has a different economical and political agenda that impedes the ability to deliver the ART regimen. The first strategy to the HIV problem is to give the combined antiretroviral therapy to suppress the HIV progression. This expensive treatment is the only option equipped to inactivate different stages of the retroviral life cycle. A homosexual HIV-infected man could be prescribed 2 nucleotide reverse transcriptase inhibitors and 1 protease inhibitor to control the infection with a better quality of life. The Global Prospective Cohort Study analyzed the social and economical impacts providing ART to HIV-infected children. It proved that starting ART early had a 48.9% statistical significant difference in improving quality of life compared to the educational programs teaching about HIV management. Despite the inferior global coverage to ART, it remains to be the only solution to contain the transmission of the HIV infection still needs to be solved in 2 other ways: reconstruct how the medical professionals diagnose and treat HIV, change the public's perception on the HIV's illness. The 1985 license screening test was the first technique to identify the presence of the antibodies against the retrovirus. USA successfully implemented this antibody test to screen potential blood and organ donors. USA was able to minimize blood transfusions from being the primary method of HIV transmission through this antibody test. Unfortunately, some impoverished countries are unable to incorporate this technique because of their lower socioeconomic status and human resource crisis. Therefore, mass-producing affordable antibody tests would eliminate the financial burden to correctly diagnose HIV illness. Schneider warns the pessimistic attitudes negatively impacts the welfare of everyone. If judgment is placed inappropriately in a professional environment, patients will perceive HIV as a condition not to take seriously and they will not follow medical protocols. Malawi and Cape Town experienced a high prevalence of incidents of HIV. Both African communities did not have enough well-trained medical professionals to identify and manage the HIV epidemic, so in 2004, they both implemented projects that required all the following experienced professionals to screen and treat HIV-infected patients: doctors, epidemiologists, nurses, laboratory technicians, and outreach workers. This doctor-intensive approach was proposed to improve the quality and structure of the comprehensive HIV healthcare system on the local front. Both Malawi and Cape Town demonstrated the positive influence of organizing the diagnosis and treatment of HIV. Only if well-developed countries like the United States and Netherlands continue to supply trained professionals medical supplies, and financial support. When Tanzania's hospitals in the public sector suffer negative social consequences due to the human resource crisis for managing HIV infection, there is a negative connotation among the healthcare workers to help out these sick patients for fear of contracting the disease. Poor working conditions, low incomes, little medical supplies, and pessimistic attitudes contributed to a discouraging environment that caused nurses and doctors to be less professional and more judgmental towards patients suspected of HIV. Patients became less inclined to seek the proper medical interventions because they do not want any negative criticism about their lifestyle. Therefore, Tanzania needs to restructure how medical professionals inform the public about the risk of HIV while reserving any judgment about the patient's choices. Tanzanian healthcare workers should overcome the social stigmata that HIV patients do not deserve this available treatment and stop instilling blame about their behaviors. Once discrimination is taken away, wealthier countries like the United States would be more forthright in donating money, providing qualifying volunteers, and replenishing ART supplies. If motivation to fix the HIV epidemic is cultivated in the public's response, will the desire to learn how to change the lifestyle and manage their HIV diagnosis. The future of the public health HIV problem relies on further advancements to the antiretroviral treatment that everyone can obtain readily. Meta-analysis positively confirmed that self-testing with rapid blood-based diagnostic tests offers a reliable universal approach to correctly identify HIV-infected individuals. Even though the systematic review contains some selectional bias, this highly sensitive and specific self-testing method is a great alternative for patients with a lower socioeconomic status. Wainberg encouraged philanthropic organizations and global initiatives to take action on funding the research required to strike before the HIV virus builds resistance against the current medication. Hirsch urged a transformation towards the development of cheaper and simpler pharmaceutical interventions that the Food Drug Administration monitor its sustainability, efficacy, and safety to all populations. Masao reported Thailand developed a safe adjuvant protein-based vaccine. The vaccine combined viral vectors containing HIV, immunogens, and glycoprotein subunits 120. This phase 3 clinical trial in 2015 proved that there is hope in building a protective adaptive immune response against the HIV viral structure. The cost-effective vaccines that are capable of binding to the HIV highly mutated property is the primary focus for HIV prevention. In my opinion, Bill and Melinda Gates Foundation and UCI philanthropic organizations should put their priority in providing ART to communities burdened with high rates of HIV infection and minimal access to effective therapy. Continuous financial support for low and middle income countries would offer only a partial solution towards closing the HIV prevalence and incidence rates. Therefore, the best strategy to prevent HIV is to mass produce ART medication. I was convinced from the global cohort study the success of early ART intervention slowed down the progression of HIV. So if sub-Saharan Africa implemented this in their health protocol, their attention will focus more on prevention and less on managing high volumes of infection. I do not believe that abstinence programs are culturally accepted as a good prevention method. Education about HIV transmission is the best way to inform the public about the dangers and deter them away from risky behaviors. My last opinion is that the preventive and therapeutic vaccines that induce broad neutralizing antibody production are the second best goal towards HIV prevention. Herd immunity can be achieved if preventive vaccines were developed for non-infected individuals as an additional adaptive memory response. Herd immunity against HIV will protect children, pregnant women, and the immune suppressed. The therapeutic vaccines are the ideal novel technique to target those carrying the HIV infection by giving them an immune booster for their debilitated immune system. Here are my references. Thank you very much.